So why don't we go ahead and get started, Hannah?
Let's do
Welcome.
it.
Yeah, let's do it. Well, welcome everybody. We at Medical Marketing Wiz and MedShift are so excited about this topic. This is the hottest topic, I believe, in longevity medicine, anti-aging medicine right now is peptides. Even my college son comes home from college and is telling me about peptides. So it's not even just us middle-aged people that are interested in this. This is something that is really blowing up people's social media, Instagram, on the news. I saw a couple weeks ago, Peter Attia had a whole thing on 60 Minutes about this stuff. So we are really excited about this. So today we're going to talk about not only how to launch a peptide program, but also how to get the word out. And I have a very special guest here with me today, Hannah Kraft. I actually had the pleasure of meeting Hannah out in California at a Women in Aesthetics Leadership Conference, and we hit it off. We kind of became fast friends, I feel like, Hannah, by the
Yeah.
end of the conference. So Hannah's with MedShift RX. I will let her introduce herself real quick. But before I do that, for those of you guys that don't know me, I'm Lori Werner. I'm the founder of Medical Marketing Wiz. Super passionate. I absolutely love doing these webinars. I would do these webinars every week if I had the chance to, because I love teaching you guys how to be successful in your practice. A little bit also about me is I am also the very much the patient that takes these sort of peptides. So you'll see on the right is my before and after. I started microdosing GLP-1s in January of this year and really just feel like, gosh, I feel better than I have. I'll be honest with you. I feel like I felt like I did in college, as far as just how my clothes fit, all of that. So I microdose GLP-1s. I also currently take GHKCU, which is the glow peptide. I take BPC 157 for my frozen shoulder, which has been working amazing. And then I also take NAD. So I will hand it over to Hannah. Hannah, why don't you introduce yourself and tell us a little bit about your peptide story, if you don't mind.
Yes. Hi, everyone. I'm Hannah Kraft. And Lori, thank you for the warm intro. I think when we met in California, it was only a couple months ago. But as you all know, Lori is easy to be friends with and talk to. So yeah, we hit it off pretty quick. But I started probably my GLP journey back in November of last year. So around the same time, but similar to Lori, I've been doing the microdosing. I've also doing the glow peptide, which includes the copper and BPC 157. And I think the biggest difference I noticed without even taking NAD was my energy, but then you can also just see the inflammation specifically in my face. I can tell my hair, skin, and nails, with the copper has definitely made a difference. And I think it's important to know we're not just coming to you guys and talking to you about marketing, but we are also patients when it comes to this. So we go to practices similar to yours and work with providers for our supplies too. So yeah, happy to be here. I'm excited to dive into everything about launching some of these programs in your practice. Some of you may have already launched them. Some may be looking to kind of dip your toe in the water. So I know Lori will cover all of that in depth today, but wanted to tell you a little bit about my background and MedShift. So I have spent more than 15 years in marketing, working across both B2B and B2C sectors. And at MedShift RX, I work very closely with aesthetic practices to help them launch and scale new products and service lines. So super excited to be a part of today's discussion around GLPs and why having the right partner for your practice can make all of the difference. And that is where MedShift comes in. So want to kind of go back to how MedShift started. Some of you may have heard of MedShift before. Historically, we have been known as a medical device company with flexible financing solutions. And that's kind of how we got our foot in the door. But as our partners' needs evolved, we did as well. So we launched this really small marketplace back in 2017. We only had about 10 to 15 consumable products, and those products really supported the devices that we were financing. And that marketplace quickly took off. And where it started with 10 to 15 products, it has now grown into MedShift RX, which has over 500 different SKUs and offerings. So MedShift RX is now a new separate branch of our organization, and our comprehensive marketplace marketplace really serves all aesthetic practices nationwide. You can see there we have over 8,000 different practices and clinics. So today, MedShift RX is considered the trusted source and supplier for everything from weight loss and peptides, but also devices and the everyday supplies and essentials that practices rely on. So all of our products are supported by our low price guarantee. And then we also have an insider rewards program with added savings and benefits, with our main focus really being on helping practices operate more efficiently and cost effectively and boosting your ROI. So, just a quick look at some of the partners and brands that we work with. A lot of these brands will likely be familiar to you all, just to kind of speak to our credibility as leaders in the industry and just the depth of offerings that we bring to our clients. So that's just a quick overview about MedShift. I will tell you today's real value is going to be with Lori. These are things that you can actually take back and implement in your own practice. So, Lori, I am going to turn it back over to you.
Awesome. Thank you, Hannah. And definitely, you guys look into MedShift. Hannah will also be happy to share any questions about towards the end. I think you may touch on just like the compliance, the quality of the peptides that they're able to offer you. So we'll dive in a little bit into that. But
Mhm.
the meat of today's discussion is going to be about ways for you to successfully launch GLP-1s and longevity peptides in your practice. So what we've been doing this, I would say, gosh, for a solid probably at least year and a half. I feel like the peptide boom has just taken off. And so I kind of packed together 6 ideas. And then I also want to throw in just some information on legal and compliance, because that's something that's very important when you're thinking about marketing. A lot of these things are off label. We want to make sure that we're, keeping you compliant and not getting in trouble or anything with the marketing, jailbird people that are out there. So we're going to talk about websites. We're going to talk about email, texting, webinars, events. Partnerships. This is something that I think is a really unique idea that we'll dive into. Even some partnerships that Hannah and I have also experienced with some places that we frequent as businesses that are partnering with medical aesthetics offices. We'll talk about social media marketing, just ways that you can market this on social media without getting flagged or without getting, put in Facebook or Instagram jail. We'll talk about lead magnets, and then, like I said, the compliance tips. And then we also always like to have a couple of little ethical bribes at the end for you to stick with us. We've got some really great resources that we'll share with you at the end. So first off, for those of you that, many of you guys understand what GLP-1s are, and we're going to touch on GLP-1s, but also other peptides. So things like the GHKCU, BPC 157, glutathione, NAD. But in terms of the GLP-1 specifically, there is so much clinical data out there, specifically when it comes to comparing the weight loss that these patients can experience versus patients that don't. So again, there is a lot of data behind this, and this is something that you can also leverage in your marketing. I think this is important. It is important. Patients want to know not only safety, but also efficacy. So when you can utilize data to back up, why you're offering these specific things in your practice, I think that's really important. This is the other thing that gets me excited. And that is, especially if you're in aesthetics. And I feel like the world of like longevity medicine and aesthetics, these worlds are sort of colliding now. We're seeing more med spas doing peptides and hormones, and we're seeing, functional medicine doctors now bringing in energy-based devices and aesthetics. But this is really, really awesome when you think about the fact that 63% of people that are taking a GLP-1 are new to aesthetics. I have had so many conversations with different providers that even a plastic surgeon, you'd think, why would a plastic surgeon start offering peptides in his practice? It's because when patients lose weight, they start feeling more confident about themselves. Their clothes start fitting better. They start thinking, you know what, I want to get a little bit of skin tightening, or maybe I want to get a little Botox. So it is absolutely a way for you to bring brand new people into your practice, into your med spa that maybe never would have otherwise come in your door. So this is a one specific article that was done by a consulting company. This also is really interesting. I will tell you that the med spas that are capitalizing on this GLP-1 and peptide wave are the ones that are taking off. So when you look at, this is a survey just comparing like 6 months different. what in your aesthetic practice are your two most popular services? In 2024, only 39% of med spas said it was weight loss. In 2025, it's already 60%. So this again is showing that this is a great time for you guys to be thinking about this. And even if you're already offering peptides in your practice, we're going to talk about some tools and maybe ways that you can kind of crank it up a little bit more as you think about your next 12 months and increase honestly the bottom line for every single thing that you do. So I want to touch first on how are people going about finding you and choosing you? So I can guarantee you that next month, this is going to be one of the top searches on Google and ChatGPT, right? Because everybody is eating too much for the holidays and they're all like, you know what? I got to get rid of these stubborn pounds. So what do? They type in GLP-1s near me. A lot of times maybe they see me and I lost a little bit of weight and they haven't seen me since last Christmas. They're like, Lori, what are you doing? And I'm like, I've been microdosing GLP-1s. They're asking me for recommendations. But then I tell them where I went. And so then on Monday, they got to Google you to get your phone number. So, or they might ask ChatGPT that question. What are they going to do next? They're going to read your reviews. So they're not going to just go to some place that has 3 reviews. They want to go someplace that they feel like is reputable. So focusing on your Google reviews not only is going to help you get found for this particular term, but honestly, every single thing that you do. Then they're going to visit your website. So making sure that you do have information on your GLP-1 weight loss program, your GLP-1 microdosing, your longevity peptides, your beauty peptides, your sexual health peptides on your website. And then they're also going to compare you to 2 or 3 others. Because remember, when they do this search, it's not just you that's going to come up, it's going to be a couple of other people. So they need to decide, are you the trustworthy person? If they're going to make the time to make an appointment with you, a telehealth visit with you, an in-person visit with you, have they done their homework to make sure that you are that go-to trusted provider, right? So, and then, and only after then are they going to book an appointment. So if any part of this chain is broken, this is really where we'll see people get really frustrated that their marketing isn't working. So we need to remember, you'll notice on this slide, it isn't find my doctor on Instagram, find my med spa on Instagram. Now, is Instagram part of what they're going to do as far as their research of you? Sure, absolutely. However, the rest of the stuff is the foundation that's going to make everything else work. All right, so let's get into the ideas. So we're going to talk about all 7 of these ideas here as we go along. And Hannah, feel free to chime in if you have anything that you want to add. I know you've got a crazy amount of experience too, so don't be
Yeah,
shy.
I think one thing too about the GLP-1s, when someone goes to search GLP-1s near me, as you mentioned, 63% of these people are new to aesthetics. So this is a huge gateway for them, not just for other services, but for other peptides as well. They'll see the GLP-1s are considered peptides. So they'll
Right.
see the GLP-1s working and then they'll ask, well, what else do you have? They'll start feeling better. They'll want to kind of add more into their routine. So the GLP-1 search can really get that patient or client in the door and open them up to other services, which I think it's good to have more than just GLPs.
Yeah, and it also is a retention thing. So I don't know the
100%.
exact stat off the top of my head, but I want to say it's something like 90% of patients that start a 3-month GLP-1 journey will refill that. So in terms of like if you think of some of your other services, yeah, Botox and injectables, people are coming in once a quarter. Laser, maybe they come in for their sessions and then you don't see them for a while. This is also a way to also keep people top of mind and keep people like more recurring revenue for you versus just
Mhm.
like, a single package or something like that. So
Yeah.
great
And
point.
I
I'm
think,
glad that you brought that up.
yeah, another thing too on outside of just the GLPs, this is a stat we can follow up with, but the peptide industry as a whole, GLP-1s included, in the next less than 10 years is projected to grow times 10. So I think the value is like 94.3 billion is what the peptide market is projected to be valued at by the end of 2034. So that's in less than 10 years. And it's growing right now from about 9 billion. So this is a huge way to, get started early, stay ahead of the competition. And, aesthetic trends are always changing. This is definitely one to hop on sooner rather than
Yeah,
later.
very good point. Very good point. All right, so we're going to dive into idea number one. This seems obvious, right? But it is so amazing to me. People will even buy a brand new device and it'll be 6 months before they put this thing on their website. So you want to make sure if you are offering peptides that you have a full page of content for each one of the individual peptides. Honestly, you should have a full page of content for every one of the core services that you offer. I did want to touch just on overall website best practices. Website really should be built in WordPress. WordPress is the gold standard for actually getting found in search, whether that search is on Google or that search is on ChatGPT. If you've built your own website on Squarespace or Wix or Weebly or one of these DIY builders, you're going to have a really hard time getting found in search. And yes, they have the SEO, search engine optimization plugins. I'll be honest with you, they're not any good. So you end up spending way more on your marketing to drive traffic to a website that can't organically rank itself. So built in WordPress, it needs to load fast and it needs to look modern. It should be a reflection. It should, it's the first impression that people are going to have of you online. As I mentioned, you want one page for every one of your core services. You want to have also making sure this has keywords that people are actually searching for, which is important, right? Because sometimes we speak in medical terminology and we don't speak in the terminology of what patients are actually searching for. Meta descriptions, that basically tells Google what your page is about. And I find this a lot of times people will have a beautiful looking website, but the person that built it is a designer and they know nothing about search engine optimization. They know nothing about keywords. So it's sort of the equivalent of having the most beautiful office in the whole world and never putting a sign outside, right? So we want to make sure Google and ChatGPT know what you do. Being credible. So again, this kind of goes back to what I was saying at the beginning when they're comparing med spa A, B, and C of where they're going to go for their longevity journey. If they land on your website and you have, your best doctor award or your board certification or you're a center of excellence or, you're a five-star Google rated office, those are things that can help your conversion where it's like, hey, you know what? I'm going to go to the one that looks credible. They have personal and authentic photos. It's not stock photos. And the depth of content. So again, kind of going back to the peptide piece, you want to have a lot of content on your website talking about the things that you want to be found for. So if it is, let's just say you want to do more peptides for GHKCU, for the glow stack. You want to have an article that speaks about that. You want to have an article about GLP-1s for weight loss, GLP-1s for microdosing. What's the difference between semaglutide and tirzepatide? Those sort of articles will help you get found by AI and by Google. Your website should not just look nice. If you're getting, I had a call today, somebody was getting like 3,000 hits a month on their website, which isn't bad for a local office. And they have like 195 people on their email list. It's like you're getting traffic to your website, but nobody's giving you your contact information. So there's something wrong with this website. So that's just something, again, to keep in mind, really honestly, for your overall marketing. I also touch on this. This again kind of lands on the website piece is take an inventory of all the things that make you special and credible. So your board certifications of your doctor, your nurse practitioner, or your estheticians, your awards, your affiliations. Maybe you're a member of the local chamber of commerce. I have one client that's a bariatric surgeon that actually just jumped on board with peptides because he's seen a significant decline in bariatric surgery. And it's like, hey, if you can't beat them, join them. So he's got peptides now that he's launching within his medical spa, but he just got his American Board of Obesity Medicine certification. That's a big deal, right? So put that on your website. So this is something literally you guys could tell your web people to do on tomorrow. It will improve the conversions of your website by up to 48% instantly because it's that credibility. I land on your website, I'm choosing between med spa A, B, and C, and it's like, boom, this is the trusted go-to source. All right, so I want to touch on email because this is your lowest hanging fruit. So all of you that have an established practice, you have patients that already know, like, and trust you. And believe it or not, doctors and med spa owners and just healthcare in general has the number two open rate of any email that goes out. The only thing that beats healthcare is religious organizations. So sometimes people are like, oh, I don't like sending out the email. Okay, you're not Pottery Barn that's sending me discounts on furniture every week. You are a medical spa owner that is providing value to your list. So email, as far as conversion, will outperform social media, it will outperform search engine optimization, and it will outperform ads. And in fact, if you're utilizing email as part of your outreach, letting people know, like, this is one of our clients, she has a GLP-1 club that she's announcing, and she's actually a gynecologist. And you're able to generate 50% more sales ready leads at a 33% lower cost because, again, these folks know who you are. They just don't know everything that you do. So I would make sure that when you guys are thinking about your newsletter, that this is something that is incorporated. And there's so many different peptides. I mean, shoot, you could probably have a little snippet about each peptide every single month for 12 months and still not get through all the education that you can do.
Yeah,
So
Lori, I want to jump in real quick too
please,
on
please
the
do.
email piece. So I actually started my career in email marketing, but I think one of the people say email marketing's dead. That is not true. And I think your email marketing list is your probably number one most valuable asset because you own that list.
Yep.
Now, social media and all of that is important. And Lori, I know you've spoken on this too, but social media is essentially your followers are rented space. Your email list you actually own. So I think this is probably one of the most overlooked tactics when it comes to marketing and really educating your list.
Yeah. I will say all the time, as far as like my ideal client, I will take somebody any day of the week as a client that has 2,000 emails over someone that has 10,000 Instagram followers because I know that that email list is gold. Also, just completely other tangent, but the valuation of your business, if you ever decided to sell your business, having a good email list makes your business so much more valuable than
Mhm.
your social media following. So
Yep.
we need to have a whole webinar all about,
On email.
I feel like. So that'll be
That'll be your next one.
to be continued. But anyways, wanted to just share with you guys just some ideas. Again, this is Dr. Wilson. She's been a client of ours, I think, for gosh, probably 8 years. She has grown from a solo gynecologist to adding multiple providers to having a medical spa, and now she has an entire peptide program. So this is just a little email blast that she's got, launching her GLP-1 club. She's giving some healthy recipes. She's highlighting her reviews. So again, it's not salesy, it's educational, it's helpful, and it just allows people to kind of, again, know every single thing that she does because they might just be coming to her for one thing. They have no idea all of these different things that she offers. Again, reactivation campaigns. I have never seen anything like weight loss bring new people back in. So this is also an opportunity for you to pull a list of maybe people that haven't been in a while. And you know what? Again, this webinar is so timely because this is the perfect time of year to be thinking about this. And now you guys have a little bit of time before early next year when this is like going crazy to be able to, have a reason to reactivate some of those people that haven't come in a while. So pulling the list of people that haven't been in, announcing new weight loss programs, peptide informative emails, as well as microdosing. And this I wanted to share with you. This is a text I actually got from one of our clients who was a little skeptical about starting a newsletter. And she was like, hey, great news. One of my frequent flyer cosmetic patients must have seen the newsletter and booked a consult for semaglutide. And I was like, yay, like nice to hear it. So it definitely does work. I absolutely love this quote by Steve Jobs. I think this is really what healthcare marketing should be all about is not marketing. It's just being the best at educating your community because we don't want to feel, I don't feel like anybody wants their esthetician or nurse practitioner or doctor to be like selling them stuff. If you can be the best at educating your patients and the best at educating your community, you will authentically be magnetic. You will be seen as that go-to leader, that trusted source. And really, honestly, the people that aren't these like price shoppers, they're the people that you want to be your clients. Those are the people that value that. So, I want to touch on webinars. And obviously, we are fans of webinars. We're here doing a webinar ourselves. I think we had almost 200 people signed up for this webinar. It's an opportunity for you guys to learn something new, right? Same exact thing that you want to be doing. So it's an opportunity for you to talk in front of hundreds of people all at one time. It allows you to build trust and thought leadership. It also helps people get to know you a little bit, right? So, like some of you have never met Hannah before, others of you have never met me before. By the end of this, you'll kind of get a feel for, do you think that we're people that you can trust or that know a little bit or you learned a little bit from? And you know what? Who knows? Maybe we end up working together. It's the same exact thing for our clients. So we really encourage our clients to do either some kind of an event or a webinar every quarter. And again, this is also really nice when we think about peptides because peptides can be a little tricky sometimes to get approved to run Google ads and to run Meta ads. How do you get around that? You host a webinar about midlife metabolism and modern peptides, women weight and menopause. I mean, there's so many different topics. The only thing you have to get by Meta and Google is the landing page. It doesn't need to say peptides on there. You can talk about whatever you want when you get on the webinar, right? So it's also nice for people where a certain sensitive nature of certain procedures. Some people don't want to go to a weight loss event. They're embarrassed to go to a weight loss. They just want to learn about like some tips and tricks in the privacy of their own home. We used to do a lot of stuff actually with one of Hannah's colleagues, Sean, who used to work at Vivive, and I used to go out to Vivive all the time, and we would do webinars on like vaginal rejuvenation. Well, nobody wants to go to the vaginal rejuvenation event. Like, I don't want to run into my neighbor at something like that. But hey, you know what? I would like to learn a little bit about midlife sexual health on the privacy of my own in the privacy of my own home. So again, whether you're talking about peptides, sexual health, there's lots of different things. It's a great opportunity and it's recorded and it's an evergreen marketing tool. It gets added to your YouTube channel. You can even take the webinar and chop it up into small little videos that now you've got 20 social media videos, all just repurposed from your webinar. So webinars are really key. I wanted to throw a few ideas, different topics, and I'm totally happy if you guys want to brainstorm about any of these ideas after we can do a one-on-one call and talk about it. These are all topics that I've seen work really well. I can tell you anything midlife, whether it's men's midlife, women's midlife, you will get a lot of people. I don't care if it's a webinar or an event. So midlife metabolism and modern peptides, gut health. Gut health is huge. I can tell you BPC 157 is a game changer when it comes to gut health. I've seen it heal ulcers. I've seen it help, fix the microbiome. There's other peptides that obviously help with gut health as well. Women weight and wellness. Anything, why am I gaining weight when I'm 49? Great topic. Men as well. Men's health over 40, menopause makeover, power of peptides. So that's just a handful of ideas for you guys. Any of them that you want to touch on at all, Hannah?
I think, no, these are all great. The power of peptides is actually something we did a while ago and kind of repurposed. This will be one of the free gifts at the end, but also the profitability of peptides. So MedShift really comes from kind of the B2B side. We're not client facing, we're practice facing. So to your point, Lori, I love the quote from Steve Jobs. I have not heard that, but I have found that you're right. Education is the best marketing when practices understand the power of peptides and how they can have an impact. When they're educated on that, they can better position it to their clients and make
Yeah.
those recommendations and then, get the credibility and stickiness from those patients.
So that might be if you have a recording of that, like diving in
Yeah.
one of the peptides, Hannah, why don't we plan to send that out also with the replay? I think
Yeah,
that'd be great.
absolutely.
Okay, cool. All right. I'm glad you mentioned that. So also events. And events, especially, in the medical device space, this is the fastest way to pay equipment off, 100%. Have an event, have an open house, have a weight loss challenge. And again, getting back to the education-based marketing, events really accomplish three things. Number one, they get your name out there. You're seen as a leader in your community. You're able to educate people. You're going to get immediate sales and ROI. So you're going to get people that are going to go, yes, finally an answer. Finally I got my questions answered. Like I'm ready to get started. And then you also have a lucrative future pipeline. So I always recommend when you do an event, make sure that you have some sort of bring a friend incentive. Because let's be honest, Hannah and I hang out with a whole lot of people just like us. Same kind of socioeconomic background, into the same sort of thing, same sort of job, job level. And we are all suffering from the same things and we hang out and we talk to each other. So your existing patients, again, are a great source of leads for you, and they don't want to come to your event by themselves anyway. So give them an incentive to bring a friend, and that is your lucrative future pipeline. Those people might not be ready that day to sign up for your weight loss program or your longevity program, but guess what? They're going to continue to kind of feel not great. Now they're on your email list. Now they're following you on social, and they've met you. And so that is your lucrative future pipeline, is staying in touch with them. And those are the people that we'll really see turn into patients. So I threw a few just ideas on here. Again, I mean, there's so many different ideas, whether it's summer, winter. I mean, there's seasonal ones that you can do. Just I would challenge you in the next 90 days to have some sort of an educational, whether it be an event or a webinar. That is going to be the fastest way to really launch this sort of stuff with a bang. This topic I'm really excited about because this is something that both Hannah and I have experienced, and I just had this aha moment when I saw this. So I'll tell you real quick. So I go to Pure Barre. Pure Barre is a kind of like a ballet class, and it's literally all middle-aged women who are ex ballet dancers probably 25 years ago, and we're trying to get in shape, and we're sick of like killing ourselves at the gym. And Pure Barre is an amazing community that partners in their community. So every month they host another business to come into their studios. And it really is a win-win for both Pure Barre and the business. So this is one that I actually took a screenshot of this. It's a wellness center that's just a couple doors down from the Pure Barre studio, like probably not within walking distance, but pretty close. And they hosted a wellness pop-up, and they were able to teach the people that came to the class all about their wellness services. They were giving away, not giving away, but they were doing B12 shots, and then you could learn about NAD. And I'll tell you what, these women, there's 30, 40 women in a class. They're all spending $200 a month to come to this studio. But the beauty of it is Aura is going to benefit, right, from getting in front of their audience, but Pure Barre is going to benefit too because you have an email list as well, and those people aren't members at the studio, and you're going to promote this pop-up as well. So it's a win-win. Honestly, if you make it a win-win, it's literally a no-brainer. So I think the cool thing is this also gets you in front of somebody else's audience. So, Hannah, why don't you share a little bit about your Orange Theory and what you ran into at Orange Theory?
Yeah, so this is my local Orange Theory studio here in Charlotte. They partnered with Relive Health in Charlotte, and this was kind of they did a pop-up in the class, but then they also did social media as well. And I mean, if you zoom in on this, you can see there's no offer. It's just this is new, this is who we're partnering with, but that cross collaboration marketing efforts with the different lists boosted obviously Orange Theory's credibility. And myself as an Orange Theory member, I'm thinking, wow, the $200 I'm spending a month is bringing value to me by offering services through this wellness studio that, again, I'm very mindful. Obviously, if I'm spending $200 a month, I'm mindful of my health and my wellness. So this is just a natural partnership that just fit. And this is how I found my current practice where I get my peptides. Went to Relive, got a consult, and then they have an agreement with Orange Theory. I think you got maybe $100 off a blood panel to where they could really evaluate maybe where I needed to improve some of my levels. But yeah, I think events like this is mutually beneficial and it's a win-win. There's no cost involved.
Right. Yeah. So, I mean, again, we know Pure Barre and Orange Theory. I can tell you that these organizations, I don't care. I think it's probably in the culture of the franchise to encourage this sort of thing because it's not just unique to the two studios that we've worked at. So I would go like look to see if there's some of these locally in your area and just say, you know what? Hey, I know that you guys do this. Would love to collaborate. Here's what we bring to the table. We're going to promote it on our social. We're going to promote it to our email list that has this many people on it. So I think again, if you can create a win-win, it literally is a win-win-win. And it's a win-win for the patient too. And to
Mhm.
your point, Hannah, and I hadn't even thought about it like this. It does make me feel like, my Pure Barre money, I feel like what I'm spending there is going farther too, because it's cool. They're bringing people to me that are able to teach me about my wellness that I didn't even realize was kind of part of my membership. So,
Yeah.
yeah, I like that. All right, cool. So, I just threw some other ones that I know are usually very collaborative. CrossFit is another one. Again, when you think of CrossFit, these people are working their butts off. CrossFit is very competitive. They do get injuries. You've got BPC 157, TV 500, which really helps with, you know, recovery and those sort of things. So, nutritionists, personal trainers, health food stores, yoga studios, hair salons, estheticians, physical therapists, these also can be great referral sources for you too. So let's say the physical therapist, people are going through physical therapy. It's good for them to at least know that you offer peptides, even if maybe they're not offering them. Maybe that's an opportunity for the two of you to sort of collaborate on that back and forth as well. So I want to just touch briefly on marketing your events. The biggest piece of advice that I could give you about these events is you are targeting busy professional people. You cannot start inviting them 2 weeks before the event. Webinars, you've got a little bit, you don't have to market a webinar very far in advance. But if it's an in-person event, I already know where I'm going the next 2 weeks, whether it's my work obligation, kid obligation. So even though I might want to come to your event, if you're only giving me 2 weeks notice, chances are I probably can't go. So at least 4 weeks of solid marketing and probably at least 2 weeks for planning. You want to make sure these people are registering. If they just tell you they're coming to your event, I hate to break your heart, but they're probably not coming. They're going to forget. They're busy people. You want to make sure they register. So have a landing page. A very easy place to put landing pages is Eventbrite. It's free. The cool thing about Eventbrite is they actually even send them like a ticket to the event for whatever reason, when we started doing our client events on Eventbrite, we got a lot higher show up rate. I honestly think it's this like silly little ticket that they get sent. The other cool thing about Eventbrite is if I've ever gone to another event in like, I just went to like a yoga event, for example, that I registered through Eventbrite, Eventbrite will send me an email. Hey, Lori, there's some other events in your area that might be interesting for you because they know what my interests are. We will usually get like a dozen people that will register for an event or a webinar that aren't even on the client's list, and it costs us zero. So, Eventbrite, great place to, again, make sure you get people registered. Obviously, we want to promote on social media. You can boost the post, so add a little bit of money behind it to be able to target kind of that busy professional person in that age group that's in your zip code. Add it to your website, your Google business profile. So, your Google business profile is a core element of your search engine optimization. Add your events. That way, Google knows that you've got an event coming up. That helps you with SEO. Also, doing press releases. So, press releases are a way, it's basically a blog article for the most part that you're sending out via Newswire. And this gets picked up on your local TV station's website, their radio station, the newspaper, and it helps you get links, authoritative links back to your website. And I will tell you real quick, we do a lot of press releases for Medical Marketing Wiz just when I'm doing speaking events or I'm going to this conference. And it's funny because one time somebody booked with me a marketing call and it was to get me to market their medical conference. And I thought, well, how in the world do they think that I market a medical conference? It doesn't say that on my website. So I asked him, how did you hear about us? They said ChatGPT. So I was like, okay, that's interesting. So I did the call. And then after the call, I went and asked ChatGPT, I just did this call with this person and it said that you recommended them. How did you put two and two together that I would help them market their medical conference? And the answer that they gave me is all the press releases that I have done. So I mean, I can tell you this stuff works. So press releases for your events, your webinars, and then as we mentioned, partnering with those like-minded businesses. That is just a win-win-win for everybody. I do want to touch on social media. So being omnipresent, again, this is really part of people's decision-making process when they're researching, is this a trusted place for me to go? So making sure that you are utilizing social media. We have an AI-powered social media platform called the Dr. Social Wiz, which is just a great way for you to be able to generate content, super easy. You can pre-schedule it so this just doesn't become some big, huge time vampire. I feel like that is the one mistake people make is I ask you what's your marketing strategy and your whole marketing strategy is posting on Instagram. And again, as Hannah mentioned, you don't own those followers. So just at the end of the day, yes, you need to do social media, but remember that content is not sticky. You want to create sticky content, blogs, YouTube videos, press releases, things that are going to help you with keywords for years and years and years. One very low hanging fruit, I will tell you guys, is these Facebook groups. There are so many Facebook groups out there. There are weight loss Facebook groups. We're getting ready to move to a new town. So you guys can probably tell I'm from the Midwest with the way that I talk. So I'm moving to Brighton. So I've already joined the Brighton Facebook group because I'm going to need to get a new hairstylist, a new dentist, a new dog groomer, a new doctor potentially. And here we go, looking for recommendations for a doctor who specializes in hormone therapy, preferably somebody who has experience with surgical menopause. 7 comments. Here's a menopause support group I'm in. What's your take on peptides? I'm really excited. 33 comments. Anybody seeing an integrative or functional medicine doctor? Looking for a doctor that actually listens to me, 32 comments. So this is also another place where there's a lot of word of mouth recommendations. I would make sure that your team is at least in these groups, right? So if somebody says, hey, I'm looking for a doctor that specializes in hormone therapies, or what's your take on peptides? You can chime in and talk about your practice and the time and care that you put into making sure that you're sourcing peptides from reputable sources and all of that. So those groups. Again, Hannah mentioned this. Posting does not bring in patients. So posting consistently is not enough. Only 1 to 2% of your followers will ever give you their contact information or ever convert into a patient unless you have some sort of lead capture system. So if you don't have an email list, you don't necessarily have a long-term relationship. So we want to take those social media followers and we want to give them something that's good enough that they're willing to give you their contact information. So Hannah, you nailed this a couple of slides ago. Actually, I'll let you do this one if you don't mind.
Oh, I didn't even I didn't even read ahead. Yeah, again, just to reiterate, you do not own your social media accounts. Meta owns them. You don't own your Google ads. Google owns them. So basically, your followers, while it's all great to post for awareness, um, really what's going to drive the needle is in my personal opinion is the email list. It's going to be your more engaged people.
Yep.
Again, I still think it's important to post. That's a huge aspect of that to Lori's point. But Meta changes their algorithm all the time. I was actually on a call with one of our Google account managers who was trying to show me something, and he was like, this button was here yesterday, it's not here anymore. So these platforms are constantly changing. And back to your email list, that's what you own.
Yep.
So, yeah. Sorry, Lori, I didn't
No,
mean to steal
I
your
I, I
thunder on
kind of
that.
threw that one at you, but I knew you had a good insights on that. So just a way to be able to capture people's email, right? So you can use social media. You can even run ads where you're giving away something for free in exchange for the people's contact information. So I just threw an example here, a little peptide e-guide, everything you need to know about peptides. You're running ads to this. This can be on your website. It can be on your Google profile. It can be on your social media. And in order to get this freebie, they've got to give you their contact information. And then you can set up automations where they automatically get an email, they automatically get a voicemail drop, they automatically get a text message from your office, that's, boom, right away. You're delivering this to them immediately, and then you're touching them. And now you've got the person's contact information. They're getting invited to your webinars, your events, they're getting your newsletters, they're following you on social, and you own that list. So just to give you a little idea on that. Last but not least is just making sure that we're staying compliant in our marketing. So there are some things when we talk about peptides that we want to make sure that we are mindful of. So I threw a couple of just examples on here, of something that you should include in your posts, your emails, and on your website. So again, this content is for educational purposes only. It's not medical advice. Peptides are prescribed based on individual medical evaluation, and results vary. And then again, on your footer, just making sure people understand that these services, medications, and compounded products are provided only after a medical evaluation, and they may not be appropriate for all individuals. So that just kind of keeps you compliant. And then also just avoiding any sort of grandiose claims. And I think this is true. Obviously, this is true for peptides, but to be honest, you guys, you don't want to make guarantees for anything. We're not claiming that this cures disease. We're not guaranteeing a certain amount of weight loss. And I will see this in a lot of people's kind of cringy marketing, as they're putting like guaranteed to lose this many pounds. Not only is that not true, but it can get you in trouble with like the legal world. So again, do not say we have Ozempic or we have Zepbound, right? You are not allowed to use those drug names. So that is very important. I wouldn't even have them mentioned anywhere in your marketing. It just opens you up for potential lawsuits. And then again, I mean, a lot of this is obvious, but I think it's just important, to make sure that you guys
Yeah,
understand.
and Lori, I'm going to jump in real quick too. It's not just Ozempic and Zepbound or Mounjaro. You cannot say tirzepatide and you cannot say semaglutide either. That will definitely get you in trouble. I know a KOL specifically that got a letter by having tirzepatide on her site. So
So it's
definitely
just better
avoid
to
those as
say
well.
like GLP-1
Or
or
weight loss.
GLP or weight loss. Got it.
Yes, weight
Got it.
loss options. Yeah.
Okay. All right. Very good. All right, so wrapping things up, these are really just kind of five little bullet points, right? The new reality is these peptides and GLP-1s are what is fueling med spa growth. This is not going away. And honestly, you guys, it's kind of like if you can't beat them, join them. Like this, I even had a client in Florida recently that was like really trying to have this like whole natural alternatives to GLP-1s, and he's was about ready to like close his business. And it's like, you know what? I need to embrace this. And so here he is, and he's, turning things around. So foundations, making sure those are in place, your website, your search engine optimization, your answer engine optimization, remembering that your owned channels are what actually drives your conversion. So growing your email list, growing your text message list, education-based marketing. At the end of the day, not selling, but just educating. And then the compliance protects your growth. So I'm going to hand it over to Hannah real quick just to talk a little bit more specifically about MedShift RX, and then we'll round it out with our freebies.
Yeah, I think that's a great segue, Lori. This is all really great info. I even learned a few things. But now that we've really, Lori's touched on the strategy and what it takes to launch these programs successfully, the natural next question is going to be, where do you actually source these products and to keep your program running smoothly? And that's where MedShift RX comes in. So I just want to take a couple of seconds to touch on why so many practices are sourcing their weight loss and peptide programs through MedShift. So just some really important highlights here on the compliance piece. We've gotten a couple Q&As here coming through asking about sourcing peptides, and this is really important when you are administering these to patients, finding peptides that are manufactured in the US. So all of our partners are manufactured exclusively in US based facilities in a closed supply chain. So that's important because these pharmacies are managing the sourcing, production, and handling of all materials in a closed supply chain instead of purchasing the raw materials from an outside supplier. And then we also have 99% or more verified purity with MSDS, so material safety data sheets and certificates of analysis available for every product on our site. And then our regulatory compliance, we work with a 503A pharmacy, only available in certain states, but they comply with state and federal regulations, USP standards, and strict quality controls in place. And then for all locations, we work with another manufacturer out of California who operates under CGMP, which is Current Good Manufacturing Practices, and they are ISO 9001 certified. And the big part of our peptides is that they are made using FDA green list APIs. So those are the ingredients that go into the peptides, and the FDA has a green list. We only use APIs on that green list. And then just for continuity of care, our fast fulfillment, most orders ship within 48 hours. So, natural next step, there's a QR code here, and we'll follow up with an email as well. But it's easy to create an account. We're offering 10% off to all webinar attendees today. It takes less than a minute to register, and this offer is exclusive only to you guys for joining us today. And hopefully, this will help you launch or expand your programs faster. And with MedShift too, we really do look to partner with you guys. So, any questions, we have dedicated support teams to answer any additional questions in regards to peptides and where they come from and kind of our pharmacy and best practices.
Quick question for you, Hannah, on
Yeah.
that. So I'm assuming, and correct me if I'm wrong, so if a clinic or a med spa wants to bring in the peptides, um, do you help them kind of figure out like how many they should buy at a time and that sort of thing? Or how does that work?
So we do have dosing guides on our site. Again, it's going to be patient specific.
Okay.
One thing about some of our peptides, so we have two different offerings. We have the 503A pharmacy, and then we also have a lyophilized version. So our lyophilized peptides have a much longer shelf life. So practices looking to buy in bulk
Okay.
can do so, and they'll have a longer shelf life as they start to ramp up and bring patients on.
Okay.
Yeah, we have a great dedicated sales team that can help kind of with quantities and good peptides that work well together. But ultimately, it's going to depend on the patient volume interest. If you have like an interest form, that's a good way to gauge maybe how many of your current current clients would be interested. And that could be a good way to help launch as well, just
Okay.
knowing what that interest is.
Okay. Okay. That's good to know. So you guys can help them with all of that. All right, great. So again, we went over a lot. Not that you have to do every single one of these things, right? We want you to just be thinking about like, hey, that was a good idea. You know what? I really do. I've kind of gotten away from events, and that's something that I really want to do this next quarter. So just thinking about maybe one or two things that you can implement right away, or maybe something that you're doing that you're like, hey, you know what? I could probably do that a little bit better. We at Medical Marketing Wiz are also more than happy to brainstorm, meet with you guys, come up with a marketing strategy, not only for weight loss and longevity peptides, but honestly, your entire marketing strategy. One of the things that we do, and this is actually going to be free for everybody, we will put together a 30-page marketing analysis. This is going to go through your website, your search engine optimization, online visibility. We'll talk about email marketing ideas. So this is a great like brainstorming opportunity, and we will email you the entire marketing analysis report. Our team puts those together, and they do take a lot of time. So it's something that I'll get thank you letters after the calls. They're really helpful. Also, every single person that is on this webinar will get a free copy of our book. We have a book on Amazon called Anti-Aging and Longevity Marketing. We will even ship this to you. We will even pay for the shipping cost. So if you are interested, we will send out with the replay also a place where you can give me your contact information as far as your mailing address, but you can also scan this QR code. And we're very excited to be able to get that in the mail for you. And then, Hannah, maybe you can touch just on this. This is awesome. I'm so excited about this.
Yeah, and I have your other book, but I didn't know about this one. So
Oh, I'll get
I'm
you
going
that
to
book
take you
too.
up on that offer and register so you can send me one too. No, but this is just an ebook on profitability. So kind of a strategy. We have pages for all our GLP-1s and some of our most popular peptides. This just gives you a good starting point based on market research, kind of average costs per month goes into um, what dosing is your patient on, the average cost per month, the cost through MedShift RX, and each of these are broken down into based on different dosing guidelines, your monthly profit, and then your potential yearly profit based on how much you charge. And obviously, that will vary based on your location. But we also have this really cool tool on our website. It's a peptide dosing calculator. We still get a lot of questions. Hey, how do I reconstitute this? How much bacteriostatic water should I put in if I want to provide a 5 milligram dosing? So this peptide calculator will really help and kind of spits out the units that each you need to draw up for each injection. So just another helpful resource for you guys to get started.
And we'll include that with the replay. So
Yes.
everybody will get a copy of that as well. So thank you for putting that together. So again, here's our contact information at Medical Marketing Wiz. Hannah, this was so much fun. I
Yes. I want
really
to do
had a
another
lot of
one.
fun. We've already got some ideas of like our future webinars that we want to do as well. So we would love to hear your feedback. If you guys enjoyed this webinar today, please let us know if you have ideas of other ones that you want. We have really just started our partnership with MedShift, and we're very, very excited to be able to just bring value because at the end of the day, it's all about win, win, win. And if we can help you, it helps us and it helps the patients and helps more people find you guys. So, all right, let me just see if there's any other questions on here. All
Yeah,
right.
I answered a couple questions
Okay.
live. The dosing guide we will send out. It doesn't have all of our peptides on there, but we do have individual dosing guides for all peptides. If you reach out to us, we can follow up with that, Matthew.
Fabulous. All right, we'll get the replay out here shortly. Hope everybody enjoyed it, learned something new, and we're excited to follow your journey and see the growth of your peptides here in the next 12 months.
Yep. Thanks, Lori.
All right, thanks, Hannah.
Bye,
Appreciate
guys.
it. All right, bye, guys.